So today's lecture topic is pulp. So first we start with introduction. So the term pulpa derived from Latin primarily indicates an animal or plant tissue which are moist and soft occurring in the form of cohering mass. Dental pulp can be defined as a richly vascularized and innervated connective tissue of mesodermal origin enclosed by dentin with communication to the periodontal ligament. So the diagram which is showing the part of the pulp. As we see in this diagram, the pulp is enclosed within the enamel and denti. The dental pulp occupies the center of each tooth and consists of connective soft connective tissue. The pulp is housed in the pulp chamber of the crown and in the root canal of the root. The pulp present in the crown is called coronal pulp, and the pulp present in the root is called the radicular pulp. The shape of the pulp therefore resembles the shape of the tooth in which the tooth it is housed. The total volume of all the permanent pulp is the 0.38 centimeter cube, and the mean volume of a single adult human pulp is 0.2 centimeter cube. Molar pulp are 3 to 4 times larger than the incisor pulp. So this is the table which showing the different volumes of the different teeth. For example, for central incisor, amount of pulp is the 0.012 centimeter cube, and for mandibular central incisor, the volume of pulp is 0.006 centimeter cube, and so on. Coronal pulp. The coronal pulp in young pulp resembles the shape of the outer surface of the crown dentin. The coronal pulp has six surfaces: the roof surface, the mesial surface, the distal surface, the buccal surface, the lingual surface, and the floor surface. It has pulp horn, which are protrusions that extend into the cusp of each crown. The number of these horns does depend on the cuspal numbers. The cervical region of pulp or organs constrict, as does the contour of the crown, and at the zone the coronal pulp join the radicular pulp. Because of the continuous deposition of dentin, the pulp becomes smaller with age. This is not uniform throughout the coronal pulp, but progress faster on the floor than on the roof or side walls. Now the radicular pulp. The radicular or root pulp is the pulp extending from the cervical region of the crown to the root apex. In the anterior teeth, the radicular pulp are single and posterior ones are multiple. They are not always straight and vary in size, shape, and number. The radicular pulp of the portion of the pulp are continuous with the periapical connective tissue through the apical foramen or foramina. The dentinal wall tapers and the shape of the radicular pulp is tubular. During the root formation, the apical root end is wide and opening is limited by an epithelial diaphragm. As the growth proceeds, more dentin is formed so that when the root of the tooth has matured, the radicular pulp is narrower. The apical pulp canal become smaller also because of the apical cementum deposition. The average size of the apical foramen of the maxillary teeth in the adult is 0.4 mm. In the mandibular teeth, it is slightly smaller, being 0.3 mm in diameter. The location and shape of the apical foramen may undergo changes as a result of functional influence of the teeth. A tooth may be tipped from horizontal pressure, or it may migrate mesially, cause the apex to tilt in the opposite direction. So this is the diagram which showing the part of the pulp and the apical foramen. Under these conditions, the tissue entering the pulp through an apical foramen may exert pressure on the wall of foramen, causing resorption. At the same time, cementum laid down the opposite side of the apical root canal, resulting in the relocation of the original foramen. Sometimes the apical opening is found in the lateral side of the apex, although the root itself is not curved. Frequently, these are two or more foramina separated by the portion of dentine and cementum or by cementum only. Now the accessory canal. Accessory canal leading from radicular pulp laterally throughout the root dentine into the periodontal tissue may be seen anywhere along the root, but most numerous in the apical third of the root. They are clinically significant in spread of infection either from the pulp to the periodontal ligament or vice versa. The mechanism by which they are formed are not known, but it is likely to they occur as where there is premature loss of root sheath cell because these cells induce the formation of odontoblast which forms dentine. Accessory canal may occur anywhere in the developing root encounter the blood vessel. If the vessel is located in the area where the dentine is forming, the hard tissue may develop around it, making a lateral canal forming from the radicular pulp. So this is the diagram which is showing the accessory canal mainly in the apical third of the root. Now we start with the zones of the pulp. So central region of both the coronal and the radicular pulp containing large nerves and nerve trunks and blood vessels. Peripherally, the pulp is circumscribed by the specialized odontogenic zone composed of odontoblast zone, cell-free zone, cell-rich zone. The cell-free zone is a space in which the odontoblast may move pulp bud during tooth development or later to limited extent in a functioning tooth. So there are three zones. First one is odontoblast zone, next one is cell-free zone, and the cell-rich zone. So this is the diagram which is showing the zones of pulp. As we see, the first zone is odontoblast zone, second one is cell-free zone, and third one is cell-rich zone. Cell-free zone mainly known as wheels zone. So now we start with composition of dental pulp. So as we know, there are two components of pulp, cellular and extracellular. In cellular, there is most common cell is fibroblast. Second one is odontoblast, and third one is undifferentiated mesenchymal cells. Fourth one is defense cells, which is neutrophil, basophil, eosinophil, lymphocytes, blood monocytes, macrophages, dendritic cells, plasma cells, and pulpal cells. In extracellular cells, there are fibers and there are ground substance. Mainly two types of fibers are found, collagen type 1 and collagen type 3. And in extracellular ground substance, there is chondroitin B, A, B, and hyaluronate. And in proteoglycans, mainly two types of proteoglycans are found, syndicane and versicane. Now in glycoproteins, there are laminin, tenascin, fibronectins, and integrins. The cell-free zone is a space in which the odontoblast may move pulpward during tooth development and later to limited extent in a functioning teeth inconspicuous during early stage of rapid dentinogenesis, since odontoblast migration would be greatest at that time. The cell-rich layer, composed mainly principally of fibroblasts and undifferentiated mesenchymal cells, is restricted to the coronal region and is formed during the pre-eruptive phase of tooth. During early dentinogenesis, there are also may young collagen fiber in this zone. Intercellular substance. Intercellular substance is dense and gel-like in nature, which may appear in form fine granular to fibrillar, and appears more dense in some area with clear spaces left between various aggregates. It is composed of both acid nucleopolysaccharides and protein polysaccharides, which are known as glycosaminoglycans and proteoglycans. During early development, the presence of chondroitin A, chondroitin B, and hyaluronic acid has been demonstrated in abundance. Glycoproteins are also present in the ground substance. The aging pulp contains less of all these substances. The ground substance lends support to cells of the pulp, which also serve to transport of nutrients from the blood vessels to cells, as well as transport of metabolites from cells to blood vessels. Glycosaminoglycans being hydrophilic, forming a gel and contribute to high fluid pressure of pulp, high urinol, in addition to the mechanical functional help in cell migration. Versicane form the bulk of proteoglycans. Syndicane, another important proteoglycan, attached to the cell and act as a adhesion molecule between fibroblast and collagen. It also binds signaling molecule like fibroblast growth factor. Tenascin and fibronectin, which promote cell adhesion and cell migration, are absent in areas of inflammation. Integrins, the glycoproteins which interact from to form cell surface adhesive receptor, were found in the pulp to get attached to the biologically active molecule like laminin and fibronectin. Now we start with the cells of the pulp. The pulp organ is said to be consist of specialized connective tissue because it lacks elastic fibers. The fibroblasts are the most numerous cell types in the pulp. As their name implies, the function is collagen fiber formation throughout the pulp during the life of the tooth. They have a typically stellate shape and extensive process that contact and joined by intercellular junction to the process of other fibroblasts. Electronic micrographs reveals evident rough surface endoplasmic reticulum, mitochondria, and other organelles in the fibroblast cytoplasm. These indicate these cells are active in pulpal collagen production. There is some difference in the appearance of these cells depending on the age of the pulp organ. In the young pulp, the cell divides and are active in protein synthesis, but in the older pulp, they appear rounded or spindle shaped with short process and exhibit fewer intercellular organelles. They are termed fibrocytes. In the course of development, the relative number of cellular elements lie in the dental pulp decreases, where the fiber population increases. In the embryonic and immature pulp, the cellular elements predominate, where the mature pulp, the fibrous component predominate. The fibroblast of the pulp, in addition of the pulp matrix, also have the capability of the cells have dual function with the pathway of both synthesis and degradation in the same cell. The collagen fiber in the pulp exhibit typical cross striation at the 64 nanometer and range in length of 10 to 100 nanometer or more. The main type of collagen fiber in the pulp is the type 1. Type 3 collagen is also present. Bundle of these fibers appears throughout the pulp in very young pulp fiber, ranging in diameter from 10 to 12 nanometer. These fine fibrils are called fibrillin. Undifferentiated mesenchymal cells. Second, undifferentiated mesenchymal cells are the primary cells in the very young pulp, but a few are seen in the pulp are after root completion. They appears larger than fibroblast and are polyhedral in shape with peripheral process and large oval staining nuclei. The later are distinctive because they lack a ribosome-studded endoplasmic reticulum and have mitochondria with readily describable cisternae. They are found along pulp vessels in the cell-rich zone and scattered throughout the central pulp. Views from this side, they appear spindle shaped. They are believed to be totipotent cell, and when needed, they become odontoblast, fibroblast, or macrophages. They decrease in number in old age. Odontoblasts are the second most prominent cells in the pulp, reside adjacent to the predentine, with the cells bodies in the pulp and the cell process in the dentinal tubules. The number of odontoblasts correspond to the number of dentinal tubules. They are approximately 5 to 7 micrometer in diameter and 25 to 40 micrometer in length. They have a constant location adjacent to the predentine, in which they term odontogenic zone of the pulp. The cell bodies of odontoblast are columnar in appearance with large oval nuclei which fill the basal part of the cell. Immediately adjacent to the nuclei is a rough surface, endoplasmic reticulum and Golgi apparatus. The cell in the odontoblastic row lies very close to each other. Between the odontoblastic gap, tight and desmosomal junction exists. Further toward the apex of the cells appears an evidence of rough surface endoplasmic reticulum. Near the pulp predental junction, the cell's cytoplasm is devoid of organelles. So this is the diagram which is showing the cell-free zone, cell-rich zone, and parietal layer. Apart from the fibroblast, odontoblast, and undifferentiated mesenchymal cells, four types of cells are present are the defense cells. These are histiocytes, macrophages, dendritic cells, mast cells, and plasma cells. In addition, there are blood vascular elements such as the neutrophils, eosinophils, basophils, lymphocytes, and monocytes. So, blood vessels enter in. So, the other component of the pulp is the blood vessels and nerves. Blood vessels enters into the pulp through apical foramina. Sometimes accessory blood vessels also enter pulp chamber through the accessory foramen. Pulp chamber occupied by pulp, which is rich in blood supply. Blood vessels of both the pulp and periodontium arise from the superior or inferior alveolar artery. The arterial supply consists of arterioles which enter through the apical foramina, sometimes through accessory foramina also, and divided into finer branches like terminal arterioles, meta-arterioles, and precapillaries, and finally into capillaries at the arterial end. These capillaries form an extensive network in a cell-pua zone just central to the odontoblastic layer. From this plexus arise small knob-like capillary loops which extend between the odontoblast in the odontoblastic regions and reach toward the predentinal layer. The capillaries on the venous end unite to form precapillary venules and collecting venules, which in turn to form a few venules, finally exiting through the apical foramina. The flood flow in arterioles is more rapid, approximately 0.3 to 1 mm second. In venules, it is 0.15 mm, and in capillaries, about is 0.08 mm second. The largest diameter in the arterioles in the pulp is 50 to 100 micrometer. The blood vessels has three layers. The first layer consists of squamous or cuboidal endothelial cells surrounded by basal nebula known as tunica intima. The second layer consists of several layers of smooth muscle cells known as tunica media. Sometimes the endothelial cell is in contact with this muscle cell and is known as myoendothelial junction. In the central part of the pulp, the arterioles have a thick layer of muscle cells, while at the periphery of the pulp, the small arterioles show thin layers. The outer or third layer of the consists of large network of collagen fibers and around the large arteries is known as tunica adventitia. It mixes with the fiber of the surrounding intercellular tissue. The endothelial cells of the vessels contain numerous micropyocytic vessels which are responsible for transendothelial movements of the fluids. Pericytes and fibroblasts are associated with capillaries and occasionally lie on the surface of the vessels. Fine blood vessels are seen in the peripheral layer of pulp under cell-rich zone. So this is the diagram which is showing the different part of the blood vessels. First one is tunica intima, second one is tunica media, and the outer one is the tunica adventitia. Veins and venules are larger than the arteries and also appears in the central region of the root pulp. They measure 100 to 150 micrometer in diameter, and their walls appear less regular than the walls of the arteries because of bends and irregularities along their courses. Venous anastomosis and arteriovenous anastomosis appears in the coronal pulp. These arteriovenous shunt play an important in the regulation of the flow of pulpal blood. Now, there is lymphatic vessels are also present in the pulp. The lymphatic vessels are seen as small, thin, walled endothelial tube that join lymph venules in the central region of the pulp. The pulp They passes through the apical foramen as single or two large lymph vessels. They are characterized by the presence of lymphocytes and the absence of the red blood cells. Lymph vessels drain the parental ligament and pulp tissue of anterior and posterior to the submental and submandibular and these cervical lymph nodes respectively. Now the nerves. The evident nerve supply in the pulp follow the distribution of the blood vessels. The majority of the nerves enter the pulp as the non-myelinated. Many of these gain some myelin sheath later in life. These non-myelinated nerves are found in close association with the blood vessels of pulp and many are sympathetic in nature. They have terminal on the muscle cells of the larger vessels and found in function is vasoconstriction. Thick nerve bundles enter the apical foramen and passes along the radicular pulp to the coronal pulp where the fibers separate and radically irradiate peripheral to the parietal layer of the nerves. The nerve fibers in this bundle vary greatly from few as 150 to more than 1200. The larger fiber ranges between 5 and 13 m, although the majority are smaller than 4 m. The mature deciduous teeth is well innervated, especially the coronal pulp has many nerve endings terminating in or near the odontoblast layer, with a few penetrating into the dentine. Nerve extends from the parietal zone through the cell zone and cell-free zone and either terminate among or passes between the odontoblast to terminate adjacent to the odontoblast at the pulp dentin border or in the dentinal tubules. Potential neurotransmitters that are present in the nerves of the dental pulp, substance such as substance P, deoxytryptamine, vasoactive VIP, somatostatin, and prostaglandin, as well as acetylcholine and norepinephrine has been found throughout the pulp. Some neuropeptides like substance P act as nociceptive transmitter. It helps to transmit the pain sensation, while other like somatostatin act against them. It is the unique feature of the dentin receptor that environmental stimuli always elicit pain as a response. Sensory response in the pulp cannot differentiate between heat, touch, pressure, or chemical. This is because the pulp organ lack these type of receptor that specifically distinguish these other stimuli. Now the function is inductive, formation of dentin, nutritive, protection, defense or reparative, and the regressive changes. So regressive changes are the changes which occur due to the age advancement. As we know, as the age advances, the volume of the pulp is decreases and the cellular portion of the pulp is decreased and the collagen fibers of the pulp is increased. Now the development of pulp. The tooth pulp is initially called the dental papilla. The tissue is designated as pulp only after dentin forms around it. The dental papilla control early tooth formation in the earliest stages of tooth development in the area of proliferating future papilla that cause oral epithelium to invaginate and form enamel organ. The enamel organ then enlarge to enclose the dental papilla in the central portion. The dental papilla may play a role to determine the forming enamel organ to be an incisor or a molar. At the location of the future incisor, the development of the dental pulp began at the 8th week of embryonic life in the human. Thereafter, the most posterior tooth organ begins differentiating. The cell density of dental papilla is greatest because of the proliferation of cells within it. The young dental papilla is highly vascularized and well-organized network of vessels appears by time dentin formation begins. Capillaries crowd among the odontoblast during this period of active dentinogenesis. The cells of dental papilla appear as undifferentiated mesenchymal cells. Gradually, these cells differentiated into stellate-shaped fibroblasts. As the inner and enamel organ cells differentiate into ameloblast, odontoblast, then differentiate from the peripheral cells of the dental papilla and dentin production begins. As this occurs, the tissue is no longer called dental papilla, but is now designated as pulp organ. Axon of the developing nerve reaching the jaws and forms the terminal sites of odontogenesis before tooth formation start. New fiber were first seen in the dental follicle in the 11th week of intrauterine life. In the 18th week, the nerve fiber were observed in the dental papilla. At the time, first layer of enamel and dentin were formed. At about 24th week, the nerve fiber is the subodontoblastic region. So we end this topic.